welcome everyone to our COVID update. Colorado numbers are continuing to trend downward, but flattening a bit. We don't see as sharp of the decrease as we did before. So although we are having positive cases, the numbers are lower, the curve is flattening. So it's not decreasing as quickly as it was last week. You can see that also is represented by this red line where the positivity rate of the tests that are done also flattening a bit. It's not decreasing as it was. Still overall down, of course, from where we were over the Christmas holiday. Our incident rate continues to decrease also. Lake County, unfortunately, not so much for us, but for everybody else around us. And so the state has less positive cases per capita as the weeks go by, which again is good news for Colorado. Overall hospitalizations are good too. If you look at the people who are hospitalized with COVID, there are less of them than, of course, during the hospital or during the holiday. And there are ample intensive care unit beds and ventilators in our state. Deaths in Colorado continue to decrease. As you can see here, as represented by the lessening number of cases. Our current data, we had our enormous spike here with our super spreader event. But if you look at what's happening recently, we actually had a couple days with no cases, which is great news. That hasn't happened in quite some time. So hopefully that trend continues where we can have less positive cases. Our positivity rate, you can see our line, again, when we had our super spreader event that made that go up. Overall cases, a flattening of our curve, which is great news for Lake County that there are less folks who are becoming infected. Hospitalizations they continue, certainly less than they were over the Christmas holiday, but we are still capable of taking care of our COVID patients that don't need an intensive care unit. Our summary, our positivity rate is still much higher than the rest of Colorado. We've had 47 positive cases in the past 2 weeks. If you look at our positivity overall, it continues to increase, which is, speaks to our long way from herd immunity without vaccinations, but the vaccine effort is going very, very well. Colorado is obviously much lower than Lake County is. And then unfortunately, folks, here's our slide. As we all know, we had our first death here in Lake County. May he rest in peace. Okay, any questions for me?
Lisa, this is Greg. Not necessarily a question, but I'd like your opinion on something. I've seen several things recently. I saw something on TV from epidemiologists from Stanford and Harvard, who basically opined that the pandemic will be over by April. And then I saw an article in the Wall Street Journal yesterday, and it basically explained, I didn't quite understand what they were talking about, so I was skeptical. And then the Wall Street Journal explained it in more detail, saying that we show that about 10% of the people in the United States have had the virus, but they said that's not correct. They said it's from the people in the United States who have either had the virus or been exposed to it and therefore have developed T-cell immunity that is closer to 65%. And they said once we get to about 10 or 15% of vaccinations, that we will have reached herd immunity in the United States. So these are opinions, but they seem to be pretty high level opinions. I just wonder if you've heard any of that or if you've thought of that at all.
Yeah, so math is interesting. You can develop numbers that make sense to you with anything. Data is infinitely manipulable, and you can certainly find something that supports what you want to say. But it's an interesting concept, so I'd be happy to talk about the concept. So what the premise of that is that people who have had COVID are drastically underrepresented. And that we don't really know how many people are infected with COVID because lots of people were asymptomatic. Lots of people were, had very mild symptoms and didn't seek testing. And so if that's true, we know that for sure. What they did is they extrapolated their mathematical model to say, well, if we know that 10% were tested and they were positive, If we know also that 50% of folks have asymptomatic infections, and then 20% of folks have very mild infections. So if there's 70% times the, the number of population of people in the United States, and then that's where they got their number from. So again, who knows? We have no idea. And it's possible, surely, but it's certainly not fact. And I think, it's hard for us to differentiate that sometimes, because we'd all like to believe that, all of us have been infected and that we can just move on with our lives in April. But what we do know is how this virus replicates, how the virus infects folks, and that the spring is, the end of cold and flu season, and infections generally decrease because of the natural life cycle of the virus, because more people spend time outside, it's not as cold, etc. So I believe that the infections of COVID will continue year after year after year after year. Just like the infections of influenza will happen year after year after year after year. This just happened to be a particularly virulent virus that got a lot of folks in trouble. And so with vaccine technology, we will be able to protect ourselves against infections of this nature into the future. The question right now is, how quickly can we do that? And if we can get vaccines in arms by April, then yes, a lot of the infections will decrease, not only because of the natural variation of the infections in the spring, but also people are vaccinated, and our economy, our lifestyle will return back to as normal as it's ever going to get once we see a consistent decrease in infectious patterns.
Okay, thank you. Yeah, I just wanted to hear, your thoughts on that. They were referring specifically to T-cell immunity, which they say doesn't show up in antibody tests.
Exactly.
And they said that's one of the major reasons for underreporting. Anyway, that's all. I don't want to get too deeply into it. I just found it fascinating and hopeful.
Yeah, absolutely. The immunology is an amazing science. But the thing that is the wild card is the mutation variability of the virus. And so if the virus was always the same, like polio is always the same, then we could quickly reach herd immunity, and it wouldn't be an issue. But unfortunately, because we have problems with mutations of the virus, it's not as easy.
Okay, thank you very much.
Yeah.
Any other questions for Lisa, for Dr. Lisa? All right. Well, thank you as usual for that update, Dr.
Yes, sir. Have a good day, everyone.